As we vote on this bill today, I have to say that I'm deeply frustrated and I'm deeply saddened. I've experienced the loss of 3 family members to substance use disorder. They were not a statistic. They were my family. They were members of our community, and they are deeply missed. I know my own experience isn't unique, and I know several of my colleagues have shared similar experiences. Unfortunately, what we are doing today is that even after a hard-fought debate from some of my colleagues who sit on the Public Safety Committee, the bill before us remains ineffective. It adds potential racial harm and makes false promises at a time when folks are desperate for solutions. This bill is unnecessary, dare I say performative. Without this legislation, as Councilmember Herbold has said, knowingly possessing a prohibited substance and using a prohibited substance in public are already gross misdemeanors. Our state legislature clearly defined the prohibition of drug use in a public place. Similar to the bill before us, the state law encourages local law enforcement and courts to divert, but does not require it. As a subdivision of the state, our city police officers and our local judicial jurisdictions already have the power to exercise this authority. Over the past few months, we were promised a dialogue across several different task forces to discuss this bill, but only one of those groups met. Over the last few months, we were supposed to have an accompanying executive order detailing the policy directive that SPD would receive, but we've been met with excuses and delays for why we haven't seen that policy. As Councilmember Mosqueda said, we could have waited to take this vote in tandem with the release of the mayor's budget next week, where we would have a robust conversation about how we fund a system that addresses this public health crisis. But instead, we're asked to take a blind vote today with yet another promise that we'll learn later of the executive's intentions, and we'll learn that only after we take a vote. The bottom line is that this bill will not address the fentanyl crisis in any meaningful way. While we sit here on the dais, people are dying, and we're spending a lot of energy on a bill that won't help them, and I frankly find it shameful. A seminal study in Washington state found that in the 2 weeks following their release, people who had been incarcerated in state prisons were 129 times more likely to die from an overdose compared to the general public. Watching people suffer on the street is painful. We've all seen it. And there are serious solutions that could make a difference, but this bill offers none of them. So let me tell you what this bill doesn't do. This bill does not provide treatment. The $27 million is not to scale up treatment options in the city that would serve the very large-scale crisis that we have. That money is coming to the city over the course of about 18 years, which is ultimately less than $1 million a year for treatment. Hardly enough of an annual investment to call this a serious solution. On top of this, we have a looming budget deficit, as Councilmember Mosqueda mentioned, that threatens the supportive services that complement direct treatment funds. This bill will not actually increase diversion because the LEAD program that we hope to send people to is already underfunded and over capacity, and there has been no real commitment from the mayor to address this in the budget cycle. Plus, if the only way to get LEAD support is through law enforcement, then community referrals, which currently make up most of the referrals to LEAD, would be eliminated due to the limited space. Passing this bill will also not stop people from doing drugs in public, especially since those targeted by this legislation already have no place to be out of the public eye. And passing this bill will not create true public safety, despite what some media outlets have been claiming. This bill is aimed at addressing visible disorder on the street, but it is not aimed at addressing the public health crisis. Jailing people will not address their drug addictions. If we wanted to address drug addiction, we wouldn't be focused only on those who use it in the streets where we can see their suffering. We would be standing up real alternatives for everyone. Let me be clear. I understand that this bill is going to pass. And so my question to my colleagues, my question to the mayor, is what are we doing? What are you going to do to follow the public health guidance on how to address the fentanyl crisis that Dr. Faisal Khan of our Public Health Seattle-King County Department has been clear about? Dr. Khan has been clear that we need harm reduction, fentanyl test strips, naloxone distribution, health care for things like wound care for folks who are out on the street. We need low barrier housing for folks who are not yet in treatment or are not yet ready for treatment. We also need abstinence-based housing for folks who are in treatment and want to stay sober. We need treatment and management services such as access to medication, counseling, social supports, residential treatment, low barrier walk-in access. These are the things that we could be funding. These are the things we could be building the infrastructure for. These are the things that we could be talking about instead of talking about a bill that isn't going to do anything. This council has been working to address these issues for years. We have passed legislation. We have allocated funding in past budgets. And so I asked the executive, where is our alternative crisis response? Where are the mobile clinics? Where is our supervised consumption and care sites? What is your commitment to partnering with the state and the county public health to get federal support? These are all things that the council has passed in the last few years, and we are waiting for that money to be spent and those policies to get implemented. This issue has created a lot of division and misinformation in our communities. And my vote today comes out of a strong desire to stop the divisive conversations that garner one more click on a newsletter or one more pledge of alliance to someone or one more hollow press conference full of promises. I hope that as we move into the budget cycle, we can work together to find the resources we need to earnestly address this issue. I want to thank Councilmember Mosqueda for her hard work to minimize the impacts of the decisions today, despite her strong reservations. And I want to thank Melanie Cray on her staff, Asha Venkatraman on central staff, and Greg Doss. And I want to thank my chief of staff, Alexis Turla, who's been tracking all of this work for our office, along with Councilmember Mosqueda's staff. With that, I will be voting no on today's bill.
Thank you, Councilmember Morales.